Drug overdose deaths, primarily from opioids, are hitting record numbers in the U.S. Data from the National Center for Health Statistics show that from October 2019 to October 2020, there was a 30% increase in deaths from overdoses. Thanks for joining us for this week's Health News You Can Use. I'm Lindsay Stish. This week, we're talking about the rise in opioid-related deaths and alternative pain management options. I'm here today with Dr. Jeffrey Foster, an interventional pain physician at St. Luke's Health System. Thank you so much for joining us.
Thanks for having me, Lindsay.
So are we seeing this increase here locally?
Yes, we have seen an increase here locally that's reflective of the national increases. In the state of Missouri, we've also seen a 30% increase in overuse deaths. And in the KC Metro, we've seen a 15% increase in overuse deaths.
Wow. So what might be the underlying cause for this increase?
We do believe it to be multifactorial. Unfortunately, there are some people that are addicted to opiates that turn to illicit substances. And when they do that, that has led to a significant increase in overuse deaths. However, we also know that there are those patients that during this pandemic have been more sedentary. They've been living not as quite an active lifestyle as before, and that has contributed to a number of problems, whether that's an increase in obesity or cardiovascular disease, or mental health issues like depression and anxiety. All of those contribute to chronic pain. There have also been patients that don't have as easily accessible care during the pandemic. And whether that's because they don't have access to virtual visits or have, for health reasons related to COVID-19, been unable to come into the hospital or to the clinic to be treated. What that leads to is some untreated and undiagnosed, in some cases, underlying health problems that could have otherwise been avoided. We have patients here at St. Luke's that are able to have virtual visits, as well as now that we've gone back to doing our interventional procedures in the clinic, can get their routine procedures completed.
Okay. So Missouri Governor Mike Parson recently signed legislation for a prescription drug monitoring program, becoming the last state in the country to have one of these. How will this help physicians here in Missouri?
This is a very welcome introduction of the PDMP to the state of Missouri. Healthcare providers across the state are now going to be able to reference this as a centralized resource. It's a database to monitor and track drugs that are controlled substances. These substances are often dangerous and can have interactions with other medications that a patient may be taking. And in order to safely avoid those interactions or those complications, the prescriber needs to know what other substances the patient may be taking at the same time. It's really going to be something that increases the safety for all of our patients here in the state of Missouri, as well as it will improve the efficacy of our treatments at the same time.
So what side effects do painkillers like opioids have on a person, and what are some warning signs of addiction?
Yeah, some of the common side effects of opiate medications include things like nausea or dry mouth, constipation or sedation, or even a respiratory depression, which means a slowing of your breathing. That can be a very serious side effect and can even lead to death if it's untreated. There are also those safety mechanisms that we've put in place to limit or prevent the number of overdose deaths. And there's an emergency medication that can be administered with a nasal spray in an overdose situation. It can be self-administered or administered by a loved one or friend to help prevent that crisis. However, when addiction does set in, there can be a number of warning signs and symptoms that we see. It can be as subtle as a change in a person's hygiene, or they have some mood swings or irritability, outbursts. It can even be just changes in the way that they use the medication or inability to control the use or their cravings for the medication. They may even deny their use or lie about their use or go to outside sources, illicit substances, for supplementing that use. In general, we do see some social cues that can be concerning. Whether someone starts to have trouble at work, at school, at home, or with interpersonal relationships, that's when we start to be concerned about someone's drug use affecting the rest of their life. And in that case, we recommend that patients talk to not only their loved ones, but the primary care physician involved to help get them the treatment that they need.
So why is it so important to look for other ways to combat chronic pain?
We do know that there are a lot of different ways now to treat chronic pain outside of the use of opiate medications. Because of these rises in overuse deaths, we're seeing an urgency in the need for treating people in other ways. We do have good evidence that supports using procedures and alternative therapies to not only treat pain, but improve patients' quality of life as well.
So what are some of these alternative treatment options that St. Luke's Pain Management Clinic offers?
We have quite a variety of treatment options for various types of pain. Most commonly, we see patients with low back pain or sciatica. They may have neck and arm pain. They may be pre or post-surgery. They might have lumbar stenosis. Oftentimes for these patients, epidural steroid injections can be helpful. We also have some minimally invasive procedures to treat lumbar stenosis. A very common thing we see as well is arthritis in the low back or in the neck. That can be simply treated with a procedure called radiofrequency ablation. We often have patients that have muscle pains or joint pains, and we treat those as well. For those that have severe nerve pain, we also offer a couple of other different types of treatments, including nerve blocks to treat pain at the source, or stimulation devices to treat a peripheral nerve or a spinal cord for effective pain relief and improvements in quality of life. We also have a special subset of patients that we take care of, those that have chronic cancer-related pain. For those patients, there are a few other treatments that are available, including treating vertebral tumors or spinal tumors with an ablation procedure, or implanting a spinal pain pump to help them with their chronic and severe pain.
So what's your final message to people who are watching at home today?
My final message would be, if you yourself are someone that lives in chronic pain or know someone that does, whether they're on opiate medications or not, I would encourage you to have a heart-to-heart conversation with your primary care physician to discuss the underlying cause of the pain and whether or not a consultation with an interventional pain specialist could be something that could help you not only control pain, but improve your quality of life.
Great. Well, thank you so much for joining us today, Dr. Foster.
Thank you.
If you'd like to learn more about St. Luke's Hospital Pain Management Clinic and alternative pain treatments, visit stlukeskc.org/pain management. You can also stay up to date with all the latest developments on the COVID pandemic and other health news from St. Luke's at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.